And in the interest of time, we're going to begin. I'm Joanna Riha, the research lead for gender equality and intersectionality at the United Nations University International Institute for Global Health, based in Kuala Lumpur, Malaysia. And today I have the absolute pleasure to be launching the Handbook on Sex, Gender and Health, Perspectives from South Asia today. And thank you so much to everyone for joining us. Before we begin and really kick off, I just wanted to raise a few housekeeping points. In the interest of time, we're going to be keeping all our introductions quite short with full speaker bios posted in the chat. And we're very much hoping and looking forward to hearing from all of you who are joining us. So please do post your questions in the Q&A section. And finally, just to let you know that the launch is being recorded as well as live streamed on YouTube. So today, to give us some introductory remarks, I have the pleasure of introducing our new director at UNU-IIGH, Dr. Revati Falki. And she joins us from Save the Children International, where she was the Global Director for Health and Nutrition. So in the interest of time, I will hand over to Revati.
Thank you, Joanna, and welcome everybody. Welcome to the speakers, and thank you so much to all the authors for this, for your contributions to this fantastic piece of work, which I have the pleasure of introducing in a minute. So a little bit about UNU-IIGH. Most of you probably are aware, but for some of you who are joining us for the first time, we are based in Kuala Lumpur in Malaysia, and we're a designated UN think tank on global health, serving as the policy translation hub of not just for the UN member states and agencies and their programs, but also colleagues from the civil society and academic institutions. We have recently launched our new strategy, which goes until 2028. And within that, and also in the previous strategy, we remain deeply committed to tackling the root causes of inequalities in health. And today here we've really gathered, as Joanna said, for the launch of this fantastic handbook. A little bit about the context. I think we are all really in partly uncharted waters. We are seeing that, globally and in South Asia region, there has been an intensification of pushback against gender equality, bodily autonomy, human rights. And of course, this all has been worsened and accompanied by erratic funding cuts, shrinking in civic spaces, which we've witnessed quite many years now, and attacks on multilateralism with the scale and the speed at which has really accelerated in the last couple of months and years. All of this, of course, has strained the efforts and derailed some of the progress that we have made and the achievements that we have really managed to collect on the global commitments for gender equality and health equity and equality, overall. So against this backdrop, we are really indeed very grateful to be launching this much needed resource to counter some of these pressures, but also to share experiences and solutions that have been demonstrated in the region. So the handbook is a comprehensive volume edited by South Asian scholars and authored predominantly by researchers, practitioners, and activists from Nepal, Sri Lanka, India, Pakistan, and Bangladesh. And I thank each one of them for their valuable contributions. It consists of an impressive 56 chapters, and of course is a critical and much needed resource, not just covering the conceptual frameworks, the broader issues around gender, health, and well-being, gender issues in health systems, health policy making and programming, but also more importantly, evidence from the community mobilization and activism against health inequities in various settings. Over the next 90 minutes, we will hear from authors and discussants who will be speaking to the key themes that have emerged from the work developed within the handbook, but also how we can leverage this valuable resource moving forward. So we're really keen on, the uptake of everything that comes in from this brilliant 56 chapters that we see. With that, to kick us off, it is my absolute pleasure and actually an honor to introduce Professor Pascale Alotley. She is the Director of the Sexual and Reproductive Health and Research, including the Human Reproduction Special Program at WHO. And she's been the former director of the UNU-IIGH. So Pascale is absolute force behind much of the groundbreaking work that UNU IIGH has led on advancing gender equality in health and has written the foreword to the book as well. So absolute pleasure again. Welcome, and over to you, Pascal.
Hello, good morning, good afternoon, good evening, colleagues and friends. It's an immense honor to be with you today at the formal launch of this baby, the Handbook on Sex, Gender and Health, Perspectives from South Asia. It's not just a book, it's a powerful collective testimony of scholarship, lived experience, and the enduring struggle for gender justice in health. It brings to life the complexities of gender and health in a region teeming with diversity and home to a quarter of the world's population, and where gender norms, social structures, and health systems shape the life outcomes in profound ways. This launch could not have come at a more crucial time. Across the world, we're witnessing an emboldened pushback against gender equality, sexual and reproductive health and rights, and human rights. The politicization of gender and health has reached a fever pitch, with regressive policies, anti-rights movements, and rising conservatism threatening to erode the gains of the last 50 years. In this landscape of challenge, this handbook stands out as a beacon, a deeply contextual, rigorously researched, and unapologetically feminist contribution to advancing knowledge and action. It demonstrates that gender justice in health is not a peripheral issue. It is fundamental to universal health coverage, to human rights, and to social justice. Now, you'll see that throughout this book, there is evidence of how gender determines access to healthcare, exposure to health risks, and the quality of care that is received. The stories and studies from across South Asia illustrate this in vivid detail. So particularly, I just want to note a few of them, that in Cox's Bazar, adolescent girls navigate multiple vulnerabilities, displacement, gender-based violence, and restricted access to sexual and reproductive health and rights services. In Pakistan, gender roles and social norms shape women's access to safe abortion and post-abortion care, while legal and policy constraints create barriers. In India, women construction workers struggle to access maternal health care due to economic precarity and migration. And in Sri Lanka, LGBTQ+ communities and sex workers face systemic discrimination in health services. These are not isolated cases. They are structural issues perpetuated by gender-blind policies, underfunded health systems, and cultural norms that reinforce exclusion. The handbook does not just document these inequities, it calls for action to dismantle them. And yet, we also know that gender justice does not operate in a vacuum. It is deeply entangled with the geopolitics, with nationalism, with religious extremism, and economic inequality. The rise of anti-gender movements is not a coincidence. It is a strategic backlash against progress. The challenge before us is not just to defend our hard-won gains, but to push forward with renewed urgency to ensure that gender-responsive care and justice remain at the heart of our health systems, policies, and global commitments. So as we reflect on the invaluable insights from this handbook, I'd like to leave you with 4 critical priorities that must shape our work going forward. First of all, the production of knowledge that challenges and reforms. So we need intersectional research that goes beyond sex disaggregated data, and that reflects the new swear words of our times: diversity, equity, inclusion. Health outcomes are shaped by caste, class, disability, migration status, and other structural factors, and our research must reflect this complexity. We must revisit power inequities in health research, prioritizing methodologies that amplify voices from the global South and marginalized communities, rather than replicating frameworks imposed by current institutions. We need more longitudinal studies on the impact of gender on health systems, financing, and workforce dynamics, especially in light of the economic and climate crisis. And finally, we must document and analyze the rollback of rights, not just as an academic exercise, but as a call to action. Understanding how and why gains are being reversed is crucial to resisting these trends. Point 2, our health systems priorities and making sure that we embed gender responsive care at every level. And we know that gender transformative policies must be institutionalized, not left to pilot projects or donor-driven initiatives. We know that the funding is reducing significantly on that anyway. SRHR, mental health, and gender-based violence services must be integral to universal health coverage, not side programs vulnerable to funding cuts. The health workforce itself must be gender equitable, with investment in the safety, remuneration, and decision-making power of female health workers who make up the majority of the workforce, but remain underpaid and overburdened. We must address the feminization of health labor, particularly in the informal sector, where women take on care burdens with little or no pay. And community health systems must be strengthened, especially in context of conflict, displacement, and crisis, where state services fail to meet the needs of the most marginalized. Third point, advocacy priorities. We need stronger coalitions across health, human rights, feminist, LGBTQ movements. Fragmentation weakens us and unity strengthens us. Health advocacy must be both hyper-local and globally connected. The rollback of rights is coordinated across countries, and so our resistance must be as well. Strategic litigation is a powerful tool. Legal challenges have overturned restrictive laws on abortion, same-sex rights, and gender identity in many parts of the world, and this must continue. And our narratives matter. The way we frame gender and health, whether in policy spaces, media, community dialogues, shapes public perception and political will. We have not been as good as we can be in this space. We must counter disinformation with evidence-based, human-centered storytelling. And the final point, a cautionary note, but some glimmer of hope. We are at an inflection point. The gains of gender justice in health are not guaranteed. Regressive forces are working systematically to strip away rights, and many governments are complicit or silent. We can't afford complacency. So here is the hope. This handbook itself is evidence of the brilliance, resistance, and resilience of scholars, activists, and health practitioners across South Asia. Our movements are growing, from legal victories on LGBTQ rights in Nepal to grassroots advocacy for safe abortion in India to women's organizing for health equity in Bangladesh. Change is happening. And young people are leading across South Asia and globally. Young feminists, health activists, and human rights defenders are reimagining what gender justice in health can look like. We have to invest in them, we have to support them, and we have to stand beside them. This book is much more than a reference. It's an invitation to act, to resist, and reimagine. So let it serve as a roadmap, a source of evidence, and a catalyst for action. Let's ensure that our research is bold, our health systems are just, and our advocacy is relentless, and our hope remains unwavering. And hopefully by the end of the webinar today, we will leave here recommitted not just to defending the gains of the past, but to forging new paths towards a future where gender justice in health is not just an aspiration, but a reality. Thank you so much for having me.
Thank you so much, Pascal, for those keynote remarks. And I think you've driven home so many important points that we need to consider and think about, particularly in the current context, but I think recognizing what a resource the handbook is at this moment. And I think without further delay, I would like to hand over actually to Dr. Lakshmi Lingam, who is one of the section editors, to lead us through a discussion, hearing from contributors who have written sections of the handbook. Dr. Lakshmi is chair and professor at the School of Public Health at D.Y. Patil University in Navi Mumbai. Lakshmi, over to you.
Yeah, thanks so much, Joanna. You're able to hear me? The volume is good? Okay, yeah. Good morning, good afternoon, good evening to all of you. We are very delighted to have this virtual launch, and I'm delighted to anchor the authors panel. In this panel, we have 5 authors who contributed to the volume, among all the authors who contributed to the 56 chapters. Their papers cover sexual and reproductive issues, public policies to deal with communicable diseases, health activism, and advocacy for rights of women and sexual and gender diverse individuals in 5 South Asian countries. The speakers that we have today, Fatima Akhtar Boni is from Bangladesh, is an independent researcher, works on health and rights of persons with disabilities. She has authored a paper titled The Intersectional Influence of Disability and Gender in Health Seeking for Sexual and Reproductive Health in Bangladesh. And we have Tashi Chomo, who is a senior program officer from the Ministry of Health, Bhutan. She oversees the National Reproductive Maternal Newborn Health in Bhutan. And she's authored a paper on gender analysis of policies related to cervical cancer in Bhutan. Our third speaker is Anupama Srinivasan, who is an assistant director at REACH, an Indian-based non-profit organization that works on tuberculosis. And she's written a paper on how did they work towards developing a gender-responsive TB program in India. And Sara Malkani, who is an advocate at the high courts in Pakistan, has written a paper on litigating for reproductive rights in Pakistan. She has long years of experience of litigating and advocating for rights in Pakistan. And finally, we have Professor Sivamohan Sumati from Sri Lanka. She's a professor in English, Department of English at the University of Perdenia. She's an award-winning filmmaker, dramatist, poet, and academic. She has written on health systems advocacy for LGBTQI persons in Sri Lanka. So the first question to my panel is, what is your chapter about in a nutshell? And what is the key message that you would like to highlight from your chapter that the audience here would take forward? Thank you.
Good afternoon and good morning, everyone. I am Fatima Boni, and thank you so much for having me today in this important occasion. And it's a pleasure to have you all, where I can share our research about disability, gender, and health. So, before I share the research finding itself, I'd like to share our motive of this research. Actually, when we started this, if I briefly share my background, I come from a rehabilitation background. I'm a speech and language therapist. So my work area was related to persons with disabilities. And during my study time, I have seen that there is very less evidence in persons with disabilities, on persons with disabilities. And particularly when I came to public health, I learned that their sexual reproductive health rights is something that is completely overlooked. And when we wanted to do some research, we barely found any data, particularly any mass-scale data. Depending on which we can come to any conclusion for their health-seeking behavior or policy influence or something. So considering that backdrop, actually back in 2019, Bragg James Brown School of Public Health undertaken this study, which was a mass research. And we conducted the research among 5,000 persons with disabilities. And among them, we found that more than 1,900 people were from reproductive age. And due to the cultural context, we actually took the ever married participants for their data. So what we found, some of the findings were really obvious, but what we felt that we often see persons with disabilities as in one intersection. So there are persons with disabilities. But actually, when we dig deep, what we can see, there are different types of disabilities, and at different from types to types, actually there are sufferings, there are challenges, where sometimes even inadvantages are really different. And it's not only limited to their gender. So being male or female. So if anyone is female, there are always added challenges because in our parts, particularly, the women really lack agencies. So there are significant challenges for their gender, but we cannot actually ignore the male as well, because what we found that persons with disabilities, when particularly they are male, their SRHR is least spoken. So these are the scenario we found when we saw from different intersections. And if you see across different socio-economic level, their experience really varied. And we really have some persons with disabilities who have their life so perfect in terms of, I'm saying it's perfect because when we say that someone is persons with disabilities, their life is full of miseries. But what often we found that when there is proper education, good socioeconomic status is better, they're actually living better life compared to the other persons with disabilities. So this is my overall observation of the study. And if we read in detail the study, we will find that there are two dynamics we have discussed about. One is their romantic relationship. So persons with disabilities romantic relationship, and how disability and gender and other socioeconomic aspects actually have an impact on their intimate relationships. And interestingly, what we found that both men and women had different negative effects due to their disabilities on their intimate life. And particularly persons with physical disabilities face more challenge towards what they perceive as desirability. So they feel less physically desirable to their partners. In fact, for women, the divorce rate is higher. And also, if you see their SRH symptoms, so I have also seen that women actually go to the service provider lesser because they often need, they do not have the agency to talk. So they need permissions of others. And
Fatima,
also,
we'll come back again. We'll talk about the challenges in the next round.
sure,
I'll ask Tashi to respond. We'll
Thank
keep
you.
it short, right, Tashi?
Yeah, sure.
Let's
Thank you
keep it
so
short.
much,
Yeah, thank you.
Dr. Lakshmi. Hello, everyone. So I'd like to briefly highlight on the chapter that we worked on. So to develop this section, a team of policy implementers from the Bhutanese government, that is from the Ministry of Health in Bhutan, and public health researcher working on gender and health based out in India, we came together to really kind of do this analysis. And our chapter was basically to assess the gender responsiveness of Bhutan's cervical cancer strategies and related policies. And in total, we reviewed 4 strategic plans. The first one was strategic plan for cervical cancer program, Bhutan Cancer Control Strategy, National Reproductive Health Strategy of Bhutan, and National Strategic Plan for action for adolescent health. So we kind of roughly try to look at the life course approach. And we used the WHO Gender Responsive Assessment Scale, GRAS in Gender Analysis tool, GAT, to really understand how these policies really fit into gender transformative potential and to the extent which they address gender norms, responsibilities, and inequities. So some of the key findings I would like to highlight today is that we have made a very significant progress, especially in terms of prioritizing cervical cancer at the national level. However, when we looked at it deeply, especially analyzing in terms of GRAS and GAT, we found that none of the four policies were fully gender transformative, and that these policies had recognized sex as selection criteria, and just one document had LGBTI and key population mentioned, and it also had effectively address women's practical needs such as improving healthcare access, tackling transportation barriers, among others. But gender norms, roles, and gender division of labor were like not really reflected in the document. So we concluded that these policies were largely gender specific and sensitive, but it was not fully gender transformative, or that it failed to address gender norms, roles, and inequities. And so we propose two key interventions. I would like to very briefly highlight on those. The first one is on applying intersectional approach that considers the needs of diverse group, where we could also include other groups such as trans men, rural women, migratory women, non-sex worker, women with disabilities, among others. And because like I said earlier, none of the document had specified the priority subpopulation that I mentioned earlier. And the last one is to really move beyond, one-size-fits-all advocacy strategies, try to look at how we could redesign the advocacy strategies to engage all those subpopulations so that their unique barriers could be understood, and that it could lead to the improvement of overall health and towards the improvement of cervical cancer prevention and treatment. So that was the conclusion that and the recommendation that we have made in the. Thank you so much.
Thanks, Darshi. Yeah. Hi, Anupama. Can you take it forward?
Thank you, Professor Lingam. So good morning, afternoon, everyone, and thank you for this opportunity. So our chapter was on the process of building a gender-responsive approach to tuberculosis in India. And I think there were two main aspects in the chapter. The first part was actually making the case for the gender dimensions of TB itself. I think historically, globally, not just in India, TB has been perceived as a male disease, both in terms of epidemiology and otherwise. So really making the case for why we need to apply a gender lens at every stage of the care cascade, from the onset of symptoms through diagnosis, treatment, and life after TB. And I also, the other reason was that when you look at LGBTQIA communities, beyond the TB HIV co-infection, we really didn't understand too much about how they were impacted by TB. And I think it was imperative to begin that process of understanding. So the first part of the chapter really looked at this, making this case, looking at aspects like stigma, like migration, nutrition, livelihood, each of which have complex gender dynamics. And then when you look at them in the TB context, what is that story telling us? The second part of the chapter describes the process by which India's national framework for a gender-responsive approach to TB, which was developed over a 7-year process that REACH has been part of and ongoing, and that several senior gender experts who are part of this have played an instrumental role in. And we've described how that process began, both for REACH as an organization, but also then advocating for it to become part of policy and strategy with the TB program, through the process of the development of the framework itself, which was an incredibly collaborative process, development of a training curriculum, the tools to train, build capacity within the TB program at all levels. This is very much work in progress, and It's work we recognize is not going to end today or tomorrow. It's going to be a long drawn process, but we've taken the first steps and we have the policy in place. And India is one of the first TB high burden countries to have such a framework in place. So this is broadly what the chapter talks about. And one key aspect, I think, if I'd like to leave everyone with, is that we really need to look at the gender dimensions of TB as cross-cutting, and how do we integrate it across care, prevention, and diagnostics, and at every stage. And I think that's the work that lies ahead of us. Back to you, Professor Lingam.
Yeah, thank you so much. Sarah, can you go ahead?
Yes, thank you very much. Good morning, good afternoon, everyone. And it's great to be in conversation with all of you. So our chapter looks at a case, a public interest litigation that was filed in a provincial high court in Pakistan, in the High Court of Sindh, to enforce the right of women to affordable and accessible reproductive health services. The paper is co-authored by Aisha Khan, who is a researcher, and two international human rights lawyers, Melissa Opretti and Payal Shah, who were also involved in conceptualizing this litigation, which was filed in 2015. And it was filed on behalf of a woman who had developed obstetric fistula in Karachi, Pakistan, during while she was giving birth to her first child. And she lived with that condition of obstetric fistula for almost 8 years because she was unable to afford adequate treatment. And so we filed the litigation on the basis that the fundamental constitutional right of the petitioner and of many women like her who face obstetric fistula and other pregnancy-related injuries has been violated due to the failure of the government to implement maternal health policies that would lead to accessible and affordable maternal healthcare services being provided to women, and would therefore lead to the prevention of conditions such as obstetric fistula. And also the fact that women are unable to access affordable treatment for obstetric fistula, which is treatable through a surgery, also constitutes a violation of their fundamental constitutional right to life, which includes the right to health, their right to dignity, as well as their right to equal protection under the laws. So our chapter basically covers the process of developing, conceptualizing the litigation, how we worked with activists, lawyers, as well as maternal health experts to build the evidence that we needed to convince the court that fundamental rights violations had occurred and that government bodies need to be directed to implement maternal health policies. The outcome of the case was that the court ordered the government to take a number of measures to upgrade public health hospitals so that gynecological services are made available free of cost. Those measures were implemented. It took a long period of time, but over 6 years, many of those measures were implemented by the provincial health department. And the provincial health department also set up obstetric fistula repair centers in 4 divisions across the province of Sindh. So finally, just to quickly sum up the message of the chapter, it is to highlight that litigation through courts can be an effective tool for maternal health activists and advocates to enforce reproductive rights as fundamental rights.
Thank you so much, Sarah. Sumati, can you go ahead?
Yeah, I'll go. So my paper, Between Earth and Sky, Queering and Querying Sex from the Margins, is an interrogation of sex and sexuality, the idea of itself, which many of us hold as a definite and universally applicable category. In my work with 10 to 12 queer persons from marginalized communities, from the peripheries, and that by that I mean largely working class Muslim and Tamil persons. This is the point of departure. So how do Muslim and Tamil, largely working class subjects from the peripheries, navigate the multiple marginalities that mark their bodies as non-normative? Health systems produce the marginalities and respond to the struggles of queer persons. We still have a Sodomy Act, which is coming from the colonial system. But in recent times, there have been a lot of advance made on trans persons' application for sex change and what do you call it, transformation. So in my discourse with this 10 to 12 person, I followed them through some of these processes that they were accessing. And in that, I found class to be a powerful actor in the ways queer subjectivities, queer persons experience structures of power. So I look at the multiple ways in which the sexuality itself is shaped by their experience. And of course, these advances are something that people have fought for. But while they are fighting for, they also battle, in very excruciatingly painful ways, state structures, civil society, by civil society community, and family structures. One aspect that I need to underline is the rage of class in much of the research. So the people I work with, who are really clued into ideas of gender dysphoria, marginalities, gender fluidity, non-binaries, all of that, they have to access those terms, but are unable to bring class, their working class experiences to nuance it and to flesh out their own experiences. So, and in that way, I found certain contradictions, and I also want to zero in on the fact that while the people I worked with from the peripheries, from minority communities and working class people, while they battle state systems, that's the only way they can get access to any kind of medicine. Unlike the universalized discourse, which talks of choice, bodily autonomy and integrity, the people I work with, have it very fluid. They are unable to talk of, when they work with a machine, in a garment factory, and then they go to the government sector, these mesh together. They are seen as classed objects, and their bodies also, are part of that class structure. They're queer bodies. So, and then they battle with families. They get thrown out and they have huge traumatic experiences. Sometimes they're imprisoned, they are forced to change, they are forced into complicities. But at the same time, family is still seen as the only one that they can, fall back on because of their class status primarily. Again, with religion, they were battling religion and religious stricture. And there's a battle between the kind of universal language of medicine and sex and all of that, which is queer friendly, but not appealing, not attending to class structures, then, limit their ways of accessing or finding empowerment. So this is kind of what I wanted. So my paper is a long one, it's theoretical, and it's also very ethnographic in the sense of ethnography, how ethnography is structured. So it's a lot of narrative. People speak of their experiences. But this is what I wanted to share with that discourses of queer empowerment need to go beyond this universal paradigm of gender transformation or gender recognition, whatever you call it, and not be just inclusive, but also fundamentally rethink some of their pronouncements. Thank you.
Yeah, thank you all very much. Just one second round question, but please, let's keep it very short. I know each of you have grappled with very difficult subject areas, very difficult sites of studies, Also very difficult state configuration and state representation, and the kind of states that we are all located in South Asia. What do you think is the key challenge, either in terms of research or in terms of policy? If you can say that in very crisp 1-2 minutes, that will be good. Thank you. So whoever wants to go first can go ahead. Sarah or Sumati, Anupama, whoever. But very
Happy to
crisp.
go ahead.
Yeah, go ahead.
I'm happy to go ahead. So, as I said, I think now the challenge is translating the framework on paper into tangible action and operationalizing it. So, very quickly, I think 3 challenges that lie ahead of us. Number one, this came up again and again during the trainings we've done so far. Okay, fine, gender is important. Yes, we agree. But what do you want us to do? And I think making gender responsive actions tangible for health officials at the state and district level and for community health workers is something that we have to build that language and make it more tangible. Second, a lot of gendered analysis happens. We have that information, but using that information for gender responsive decision making is something that we have to both build capacity on and build interest in doing. And I think finally, since we're being ambitious, going one step further and looking at it, looking at TB through an intersectional lens. So really looking at not just gender, but gender in the context of age, caste, socioeconomic status, sexual orientation, disability status, and really building capacity within the health system to apply this lens so that we can truly deliver person-centered care for people with TB and their families. So lots of work that lies ahead. Thank you.
Thank you. Yeah. Who wants to go next? Sarah, you want to go next?
Yes,
Or
I can go next. So, with respect to the strategy that we've discussed in the chapter, which is public interest litigation to push for implementation of maternal health policies, one big challenge is that, of course, the strategy is dependent on the court for its success, and so that is a variable that can be unpredictable, and obviously we can influence it, but it's difficult to control. And litigation strategies can take a very long time, I think, especially in most jurisdictions in South Asia. So this case, for example, stretched on for more than 6 years. And during this time, particularly people who are working as maternal health activists or researchers, it's a very long stretch of time during which they have to continue to pursue the case, continue to do advocacy before the court. And so I think the lengthiness of litigation and its unpredictability can be a challenge with respect to this particular strategy. And then related to that, the fact that ultimately you can get very positive court orders, but the implementation of those court orders is, of course, the responsibility of government departments. So even after you're successful in court, you then encounter that next set of challenges of doing advocacy with the government department based on that court order itself. So those are just two of the challenges with respect to using this litigation as a strategy.
Yeah, thank you. Who next? Sumati, you want to go next?
Yeah, I could. Mine is like pondering questions of what happens now. I'm thinking of a lot of activism in Sri Lanka around LGBTIQA communities and on gender as well is funded. They're funded from external sources. There's a lot of interest, and I don't know whether there's a lot of interest, but there is a lot of, that's what kind of has brought different communities together. And for me, with cuts, I'm really worried with this large-scale cuts, I suppose, I don't know, and also right-wing, the way politics is turning right-wing, how this is going to pan out in our part of the world, particularly in Sri Lanka. And I think activists and all of us need to think about how local communities, will continue and maybe can continue in very empowering radical ways because it's our life, right? I mean, we can't wait for funding. But rethink strategies. And if anybody can help here also, I would be kind of interested in those.
Yeah, thank you. Thank you, Sumati. Tashi, 1 minute, and Fatima.
Thank you so
Yeah.
much. So one of the key challenges that we identified, especially in terms of, practical application, was when we looked at the tools GRASS and GATT. Those were largely designed in contexts where gender was applied to cis women. And even though we do not have a lot of large population affected by cervical cancer who do not identify as cis women in Bhutan, in reality, the reality of majority could be reflected, but again, having said that, the exclusion of trans men and other with cervix would ultimately stand in the way of being gender transformative. Again, one of the questions that lies is, should you use the majority or minority group as the starting point, or how do we come up with practical solution, especially when, some of the small groups of people are left behind? How do we come up with tangible solution? Even though these are work in progress, there are a lot of things to be done. And one of the other thing that we really considered was also, as issue was also, framing the gender responsive policy frameworks. Which could also be because of the implementation could be the issue because of the lack of understanding of the whole framework at different levels of, health settings. So we really need to come up with, the practical, practical that the actionable, tangible actions that could, at the bigger level, the policy level, there might be so many things, but how do we really reach whatever has been designed in a bigger way in the small, and how do you reach the grassroots level? So that is one of the issues and challenges that I see. Thank you so much.
Thank you. Yeah, Fatima, 1 minute. Yeah.
So from sorry. So from my research point of view, what I found that actually conducting research on persons with disabilities has its own unique challenges, and that is the reason many a time we attempt research on people with whom we can communicate with. But one of the biggest challenges to conduct the research on persons with disabilities who actually cannot communicate themselves and we need support. That is one of the biggest challenge, but what we found while doing the research. And many a time when it's about sensitive information, including violence, and many a time we ended up talking with the perpetrator themselves because they are the family heads who have the agency of that individual. So this is a huge challenge, and this actually often what we found that we either miss out the voices or it is fabricated. So this is something from research perspective we really need to be sensitive about. We cannot take the low-hanging fruits, whatever data we have. So having said that, we actually did try different research methods, like including ethnography. It takes more time, it takes more resources, but it's totally worth it, I would say. And another thing from policy and implementation perspective, what we found that persons with disabilities not only avoid going to service providers due to financial scarcity. Many a time, actually, service providers do not understand how to treat them. So any mother can have obstructive labor, but when it's a woman with cerebral palsy or any physical disability, it's a very common remark, why have you get pregnant? And this is heartbreaking. So they need to be treated like human. That is the first step we need to do as the policymakers and implementers, that we actually treat them as a human so that they can come to the service points. So
Yeah.
that is something, and we need to figure out how we can work towards that.
Yeah, thanks so much, Fatima. Thanks very much, all my panelists. as authors, academicians, activists, and advocates in the South Asian region, we are in a very critical point. Not only are we post-colonial countries, we also are seeing extreme communalism, right-wing upsurge, and also a global free fall in terms of behaving in the most regressive manner. Looks like countries are competing with each other to mess around with everything to do with gender, vulnerability, marginalization, areas of disadvantage, social security policies. Practically everything is being trampled. So, as women's movements, I think while we reassert ourselves, I think it's also time for a lot of mobilization across social movements, the point that Pascal made. So, I'm looking forward to the rest of the sessions. Over to you, Johanna. Thank you very much.
Thank you so much, Lakshmi, and to all the contributors who joined the previous panel. I think the handbook itself, as Pascal has said, is such a valuable resource at this particular moment, and picking up in terms of evidence and narratives of how change has, happened in some contexts, where the struggles are in others, I think really gives us a valuable resource we can leverage. And I hope as part of this next panel discussion, we'll expand on some of these themes. So I would like to kick off by introducing the three panelists who'll be joining me for the next sort of part of the conversation. We have Sai Racherla, who's the Deputy Executive Director of the Asian Pacific Resource and Research Center for Women, ARO. We have Anuradha Nair, who's the Regional Gender Advisor and Program Specialist on Gender Equality at the UNICEF Regional Office for South Asia in Kathmandu. And we have Maylin Ando, who's Director of Grant Strategy at the Women's Fund Asia, which is a women's fund committed really to supporting human rights for all women, girls, trans, and intersex people in Asia. So maybe to kick us off, I can begin with Sai. Obviously, this year in particular marks a major milestone globally in terms of political commitments towards women's rights and gender equality. We have Beijing +30 and CSW that's happening and concluding this week. And I think if we consider the examples, in terms of what we've heard in the previous panel vis-a-vis change that has been pushed forward, whether it's through activism, whether it's through community mobilization, litigation. I wondered if you could share some reflections, given ARO has been around since 1993 and seen various waves, concerted pushback, as we're hearing most recently. But given all of this experience, at this critical moment where we're seeing a lot of polarization, as Pascal said, and divisiveness across struggles that are trying to advance gender equality, how do you think we could leverage this resource and this handbook, perhaps, in building more collective action?
So thank you, Joanna, and congratulations on the launch of the handbook. And also the previous, authors panel. So congratulations on all that. I think we all agree that agreements such as the Beijing Platform for Action and also the ICPD Program of Action, these have been major milestones in terms of global commitments towards women's rights and gender equality. However, if we look at the data or the status of implementation of these commitments, especially because the Beijing Platform for Action has been the most recent one, 30 years down the lane in the Asia and the Pacific region, the evidence is actually pointing to huge gender inequalities across the 12 critical areas. And that also includes sexual and reproductive health and rights and gender-based violence. Now, but we also see what is happening is a huge data gap when it comes to assessing gender equality. So this is something that is there in the region. And I think the authors have also talked about inequalities. And the regional evidence around the Beijing platform for action, it is pointing out two inequalities. And the inequalities, as some of the authors have pointed out, is just not on the basis of gender, but also it is on the intersection of gender with age, the gender with disability, gender with ethnicity, migratory status, and many other intersecting identifiers. Now, I think many of us agree that there is a need for us to have a feminist approach of intersectionality, that to be used as a critical lens for interrogation if we really want to move forward around gender equality and human rights. Also, I thought I wanted to share is the data. If we look at data or the available data around gender equality, there is huge stagnation when it comes to indicators of maternal mortality reduction. I mean, this has been stagnated since 2015. The indicators on contraception access. Now, when you look at that, the unmet need for contraception remains high, though we say that there is progress towards contraception access. But when you look at the unmet need for contraception, that is again quite high, especially amongst young people. And some of the data points for this region also say that 140 million women in this region are having an unmet need for contraception. And again, as pointed out by the speakers, the context of extreme anti-rights and gender ideologies is only adding to the challenges and not helping us. So that is the context of the region where we are actually living in. And I think for Arrow, it is challenging, and there are many strategies and tactics that we actually use to advance our work along with our partners. And I thought I could share maybe 3 strategies, and one being our focus on advancing civic spaces for young people and nurturing intergenerational solidarity. And some of the examples there are the annual Asia Pacific Forum on Sustainable Development Youth Forum that we have been organizing along with many other regional organizations. And this is a space where we are trying to expand the civic space for young people. And we have been, successful to do this kind of action since 2017. And especially the APFSD Youth Forum, this is an official event ahead of the Intergovernmental Forum. And since 2017, we have young people who have this dedicated space where they can think about, from their perspective, what is the way forward in terms of pushing the sustainable development agenda forward. And they have been doing this, and they have been developing call to actions. And other actions in regards to young people and having young people at the fore is also our work with young feminists as part of the Women of the South Speak Out. This is, again, an intervention that focuses on young women leadership. Young women are engaged in decision-making spaces at national, regional, and at global level, and just, again, pushing the envelope forward towards advancing sexual and reproductive health and rights and gender equality norms and standards. The way we work is also to see that, when we convene these youth spaces, there's a strong component of capacity strengthening that is embedded as part of the process. The capacity strengthening happens in terms of feminist values. It happens in terms of intersectionality as a lens for work. Data-driven advocacy on sexual and reproductive health and rights and gender equality. And this is the intergenerational support and solidarity that we see as part of these youth convenings that Arrow tries to bring together to advance the agenda. The second one, which Arrow has been doing since our inception, is monitoring international commitments pertaining to women's health, such as the ICPD Program of Action and the Beijing Platform for Action, but also the Sustainable Development Agenda. And here is where our partners on the ground, who are women-led organizations, who are youth-led organizations, youth-serving organizations, climate change supportive organizations, organizations working with women and girls with disabilities. All these organizations, actually, they develop evidence-based monitoring reports on the status of implementation of these international norms and standards. And these reports are used to inform the policy and its implementation at the national level. But these reports also try to, advance the regional and the global norms and standards as well, because the evidence is there. And here what I want to focus is the evidence-based work that we need to do as civil society, research, evidence that will inform public policy and practice. The third, again, is another strategy I thought I would like to highlight is, again, our, in the last couple of years, we have been trying to advance the sexual and reproductive health and rights and justice agenda through the health system strengthening work. And only because the work, if we want to do this work, the work has to happen at scale. We believe that working with the system will ensure sexual and reproductive health services, they are accessible to women and girls in all their diversity. So we are taking some staunch steps forward in order to ensure that, we are working at scale and the reach is having a greater impact. So these are some of those strategies, tactics that we try to work in this very constrictive environment, but we are not alone is what we think. Always we are supported by many of our partners. And I think the strength of this work is in the collective. So being a collective is something that I think is also a lesson for all of us to take forward. Thank you, Joanna.
Thanks so much, Sai. And I think, on your point with regards to intergenerational advocacy, creating civic space for young people, in terms of institutionalizing knowledge, learning, evidence, the handbook really provides a resource that exists and can be leveraged for a long time to come by current, future generations as well, if we're thinking about the evidence base and what we can learn, from a very practice-based evidence pool. Maybe I can turn to Mei-Lin now and just ask, obviously funding has come up multiple times in the conversation already, Mei-Lin, in the current context. I think one characteristic, that Women's Fund Asia really strives to do is move beyond the charitable giving model, right, to influence philanthropy and resource mobilization for human rights of women and trans people. But I wanted to ask, in your view, so if we're thinking about the current funding cuts and tensions around funding, again, where can we draw on the existing evidence to build better either philanthropic models or resource mobilization models in the region or globally?
Thanks so much, Johanna. And thank you for inviting Women's Fund Asia to this virtual lunch. Congratulations to everyone who's involved in the production and the launch of this very exciting publication, actually, very comprehensive publication. We've been talking from the beginning about the funding, quite a challenging funding situation that we are facing right now, which is really making things more difficult, considering that at the same time we're facing a lot of polycrisis, the resurgence and strengthening of anti-rights movements, repressive governments in this region, and shrinking civic spaces. I'll just make a run through so that it's all in our mind how much the loss is right now. So the US funding freeze and cuts has taken away more than 40% of foreign aid globally. And as we've seen, this has been really compounded by similar dramatic slashes in foreign budgets in Europe because of how they're prioritizing defense as well as their national interests. So the Dutch has slashed 30% of its aid budget. Belgium has cut 25%. France reduced by 37%. The UK cut foreign aid by 40%. And the Swiss has also shaved millions from its aid budget in 2025. And the more problematic beyond this is that we know that gender and health programs are amongst the most impacted. And also the fact that Asia is not a priority amongst all of these governments. Having said that, I think it's now more than ever that we really need concrete evidence on why supporting gender equality, human rights, sexuality, and health is really critically important. And the handbook can really play a significant role towards this. I think there are remaining champions within the various aid and philanthropic institutions. And it's who are actually right now still struggling to push back, to really just try to carve whatever can be carved for gender equality and human rights at this point. So I think it's important that we should be able to share this publication so that they could continue to push for continued investment in these issues. I think sharing this publication with formations like Prospera International Network of Women's Funds, which is composed of almost 50 multi-regional, regional, and national level feminist and women's funds, and formations like Alliance for Feminist Movements would also be important, just in terms of multiplying in the knowledge about this publication and the evidence that it contains. Having said that, I think it's also, at this particular point, being able to change course and being also able to look at alternative funding models is also important, and be able to move away from this overdependence on foreign funding, given that this funding scenario is not going to likely to change in the next 4 or 5 years. This could be done through advocating with our governments to step up and fund gender and health, including influencing national and local budgeting. This could also be through exploring philanthropic, corporate, or individual giving in the region. This is not to say this is going to be easy. We know this will be fraught with challenges, but I think a key step would be that ensuring that South Asian civil society, especially those that are led by women, girls, trans, and intersex people, and the most marginalized and vulnerable among them, have the requisite information on hand for their own advocacy. And I think for this to happen, also a key question then would be, how accessible would this handbook be? Especially to national and local organizations who will not have access to university libraries, right? Where most likely academics would have access to this wonderful publication. But how can the 56 chapters be accessible beyond the paywall? Is it possible to create concise summaries of these articles with actionable recommendations, if not the entire publication? And can these summaries actually be available in Bangla, Hindi, Nepali, Urdu, Sinhala, and Tamil? Language justice is very, very critical in this region. I think a challenge as well would be to be able to make linkages and connect the evidence that's available in this handbook with shifting donor priorities, however difficult that is. So how are we looking at the connections of maternal health, TB? How does that connect to global security and national security of these governments that are veering away from human rights and gender equality? How does it connect to climate change? So I think those might be things that can be further leveraged in terms of getting more funding for more intersectional research on how these issues can connect to those changing funding priorities. And I think it's also important to be able to get more funding for research and case studies around the impact of these funding cuts to the various health programs, whether that's, HIV, TB, maternal health, adolescent SRH, gender affirming care, and vis-a-vis the particular constituencies that are marginalized, whether that's LGBTIQ people, women and people with disabilities, construction workers, and the varied populations that have been mentioned. So I think I'll stop there for now. Thank you.
Thanks so much, Maylin, for many of those points. And I think I'd like to hold on to your question about accessibility. It also came up as a question from people who've registered or someone who registered to attend. So we'll come back to it in the Q&A section shortly. Can I turn now to you, Anuradha, briefly before we go into the Q&A? In terms of your experience working with UNICEF Rosa, obviously in the midst of competing priorities, we've heard from earlier panelists, some of the challenges if we think about operationalizing gender responsiveness in healthcare, whether it's in Bhutan's cervical cancer plan or in relation to TB programs in India. Again, how can we leverage this evidence? Because I think speaking to a health audience is often difficult, where it's very biomedical and technical, but making them understand the value health, but in terms of gender equality, in terms of integrating gender into health programs and health policies.
Thank you, Jana and others, for inviting me to this insightful webinar, and thanks for the great discussion so far. I congratulate all the distinguished authors for the commendable piece of work that you have already done in the form of this handbook. In terms of responding to your question from a UNICEF perspective, Joanna, gender justice is crucial to realizing UNICEF mandate. And now when we talk about healthcare access, we know gender is significant. I think we are talking to the converted. But within that, adolescent girls frequently positioned at the lower end of social hierarchies, if you really look at it. So from a UNICEF perspective, in this region, we are working with the largest share of adolescent girls population globally, 174 million. And they face significant age and gender-specific vulnerabilities, challenges, deprivations, which also compound when considering additional dimensions and intersections of their lived realities. So we have triple burden of adolescent malnutrition, we have highest number of child brides in this region leading to adverse health effects. Adolescent birth rate is still at 26 per 1,000 live births, which means 2.2 million births annually to girls aged 15 to 19. In the context of cervical cancer, we know 11 women and girls die per hour from cervical cancer. This region is also the second largest contributor to global maternal and newborn deaths. And we know vulnerable groups, including, as alluded by others, girls with disabilities, migrants, refugees, out-of-school adolescents, and those with diverse gender and sexual identities often face severe health risks. Now, for UNICEF, health remains a major goal area, also but a guiding entry point for multi-sectoral interventions. And we have been making some specific investments and interventions that would look into the gender-related barriers. And I would like to highlight a couple of them before coming into how this handbook could be useful going forward. We've been advocating with the government for at-scale, multi-sectoral, impactful programming for adolescent girls, both in and out of school. And we know harmful social norms devalue girls from birth, limiting their aspirations and opportunities. So efforts are around how do you shift this? What sort of policy advocacy or public advocacy are needed to move this needle? So there are programs like, programs for ending child marriage, or programs, regional action plans on adolescent pregnancy and care, looking at multi-pronged programming and policy to support all those who are at risk, including those who are, at risk and already parenting girls. The other big angle is the community health and nutrition agenda. It's prioritized for this region. There is this focus on how we can ensure every mother and child have access to and receives integrated essential services from community workers who are fairly paid, skilled, supplied, and supervised. Linking to the previous discussion on about Bhutan cancer, cervical cancer prevention plan and the whole lack of gender responsive approaches there has been efforts to roll out HPV vaccination campaigns with the support of our partners in 4 countries. This is Nepal, India, and Pakistan, and Bangladesh. At least 2 of them have already started rolling it out. But the special efforts out here has been in terms of how do we integrate gender responsive elements there that looks at both demand and supply side barriers, including partnering with girl-led, women-led organizations and to ensure that we reach the most marginalized. So to sum up, at the regional office, we are committed to ensuring targeted country-specific interventions in policy and programming that remains prioritized, because we are too well aware that regional aggregates and averages can mask individual country reality. So we have as mentioned by others, it's a very vast and varied region. And so therefore, I think the power of data, we need to collectively rely on the power of data to showcase country-specific evidence-informed programming. So I think this is precisely what this handbook has done. So it's pertinent to have such a handbook launched at this time where we are reflecting on our journey on gender trajectories 30 years since Beijing Declaration. So by centering the voices and evidence that have been overlooked or underrepresented previously, I think this book is illuminating the health disparities and offers regional and country-specific perspectives on the work to be done. I see this book also talking about feminization of health and care workforce in South Asia. This is an area that we have been working also closely with government and partners. We have launched a multi-country evidence series which intends to guide our programming that has just completed a study exploring gender-related barriers to immunization and health services uptake in 6 countries, 6 out of our 8 countries in this region. And we were exploring how women and girls at the household level bear the disproportionate burden of getting children vaccinated, how they're managing its side effects, etc. We are exploring the effectiveness, sustainability, and ways of working with community health workers in 5 countries, investigating the multidimensional risk faced by married and parenting adolescents in the region. So these findings, along with what is already articulated in the handbook, will be very relevant for strengthening our advocacy efforts and to influence a more gender-responsive health policy and programming. Somebody from the previous discussion had mentioned about how do we translate these recommendations into tangible actions, and I think that's where the focus needs to be. And how do we advocate this with all stakeholders across the region? So I think that would be the agenda going forward. Thank you.
Thanks so much, Anuradha. And I mean, I think what we'll do is maybe open up for questions, and we have some questions that have come in from registrants. So maybe we can pick up those, and then I'll do one final round of sort of concluding remarks, or, one thing you'd like to leave us with before I hand over to Sundri. So I guess one thing that's come up is, making the links, and I think Maylin mentioned this in terms of climate change, gender equality and health, and looking at how we can draw links across different efforts and different priority areas at the moment, whether they're regional or global. And I think a similar question came in, what do some of these solutions mean if we're thinking about, gender and health, but looking at climate change and just transitions for Asia and the community? And again, I'd also welcome everyone who is part of the first panel, if there's anything you'd like to add in relation to this particular question. Sorry, I can't see anyone. So please just unmute and step in.
I think I can come in here. I mean, the whole lens of intersectionality that I think the authors and, the second panel was also talking about. I think that is very important because none of us are living in silos of, just the gender, because we are living in context of conflicts, in context of climate change, in different conflicts. In different contexts. For us to look at intersectionality as a lens in taking forward our work, I think that's a critical way forward. Maybe that can be one of the first step of looking at things.
Thanks, Sai. I don't know if anyone else has anything to add. If not, I'll maybe pick up the question around accessibility. And we had a question here, is the handbook available in different languages? And maybe I can put it to everyone who is part of the first panel even, how are you using perhaps your individual chapters or repackaging some of the content in terms of making it more accessible to diverse groups to utilize and, as part of advocacy efforts, for instance? Could you tell us a little bit more about plans or how it's being done at the moment?
Joanna, can I go ahead? Yeah, I think, one of the first things that we often realize as authors is across the board, there's so little power that we have as authors. I'm not talking about this particular book, any kind of publication in peer-reviewed journals or books basically means that you need to have the kind of money for giving, for processing it, give money for keeping it open access. And often, I think, as authors, researchers from the global south, we don't find ourselves in a position to pay, and therefore our publications are often behind paywalls. And therefore, we don't have very high levels of citation index. And we don't often come up as, very high in the ranking as scholars and researchers. So coming together and producing a volume with a focus on South Asia actually brings in a different dynamic altogether, And this book also is pretty expensive and steep. However, as individual researchers, we have our papers. And I think we were talking to Sundri about how do we make it possible that we are able to share these papers. I think given the fact that all publications go with a lot of, contracts as to what you can do and cannot do, we often are careful about how we go about putting out things in the public. But I think that's a conversation we should have, and I'm looking forward to doing that once we are done with this launch. Thank you.
Thank you, Lakshmi. And maybe actually I can introduce Sundri anyway. She will give the concluding remarks. Sundri Ravindran is the senior editor of the International Journal Sexual and Reproductive Health Matters. She's also a retired professor of public health at the Sri Chitra Tirunal Institute for Medical Science and Technology in Trivandrum. And she's the overall editor for this handbook, and very much, the driving force for bringing all of the section editors and contributors together. So Sundri, maybe I can invite you to comment on this point regarding, maybe plans to translate sections of the handbook into different languages and accessibility as well.
Yeah, let me start with accessibility issues. Lakshmi has very nicely introduced the difficulties of a Global South group trying to make, putting together a handbook of this kind that can be widely marketed and disseminated, and at the same time, facing the reality of very high pricing by the publishers. So all our effort as editors, as authors, has been to make this resource available as widely as possible. But the cost of the handbook is actually prohibitive for many of us, including us, the editors. We hope that the publishers will soon issue a more affordable regional edition. But at the same time, we are also exploring making single copies of individual chapters available on request for personal use through platforms such as ResearchGate and academia. So I do hope that we really want this to reach as many people as possible. In terms of translations, adaptations, I would say the ball is in the court of everybody else here who who are able to access this. We've pulled this off after a huge effort. And I think there are many of you here who have the expertise and the capability to modify, adapt, and translate. And I would welcome any efforts on that. Thanks.
Thank you so much, Sundri. I'm also very conscious of time. And maybe then we can pause before I hand back to you, Sundri, for final closing remarks. And, immense congratulations again to everybody. But if I can ask the final panelists, Anuradha, Sai, and Maylin, I think Maylin had to drop off actually. So Anuradha and Sai, perhaps. If you can give, one point that you'd like us to take away or remember from this webinar and these discussions.
Should I go?
Please.
Okay, I think from my perspective, I think this volume adds to the evidence base from gender responsiveness in Bhutan's cervical cancer plan to building a gender responsive tuberculosis program in India to the whole adolescent risk of violence across camp settings in Cox's Bazar, implications of COVID-19 to sex workers in Sri Lanka. So it covers a lot of ground. The uptake and impact of data are difficult constructs to measure actually, but getting the data in the hands of decision makers is a step in the right direction. And I think for us in UNICEF, it's also in terms of how we are going to use this handbook in our program and policy discussions in various global, regional, and country platforms, and with our country offices and partners. I think the usability is there, and translating it into actionables would be the way forward. Thanks.
Thanks, Anuradha. Sai?
Yeah, so I thought, the point made by some of the panelists in terms of, having summaries of the studies, and that can actually go into certain publications of women's organizations. For example, Arrow publishes the Arrows for Change, where, some of the summaries that are relevant can go into that because it has a huge readership. And then again, some of the evidence can also go into some of the policy briefs that, some of us develop. And these policy briefs, again, inform, some of the actions that need to happen in that respective areas. So maybe a mapping of different organizations and other publications that women organizations or think tanks produce, and how you can take some of these summaries into those publications can be a way of dissemination. Thank you.
Thanks so much, Sai. Sundri, I'd now like to hand over to you and just thank you once again for, allowing us to launch the handbook. It's been an immense pleasure to hear from everyone today. And yeah, really looking forward to utilizing this resource as we move forward. Sundri?
Thank you, Joanna. Dear friends, I'm really pleased to be here today at this virtual launch of the Springer Handbook. This is the fourth such event. The three previous were face-to-face events in Colombo, Jaffna, and Mumbai. At this juncture, when the mention of diversity, equity, and inclusion is taboo, we're very proud to be introducing this handbook, which foregrounds the voices of structurally excluded population and integrating an intersectionality perspective across the board in almost all the chapters. This is necessarily meant having contributions from not only researchers, but also practitioners and activists, and showcasing diverse methodologies and diverse formats of evidence presentation, going beyond research paper format. However, enormous as this volume is, its contents barely scratch the surface of the evidence on sex, gender, and health needed for effective and equitable policies, programs, and health systems. We hope that this handbook will be very widely used by educators, researchers, activists, and practitioners to inform their work, and also as a starting point to generate further evidence on this critical area. This means that we look forward to many more such publications from this and other regions of the Global South. More research and publications anchored in the Global South would call for more significant investment by donors in research and capacity building on sex, gender, and health, and by publishers in seeking out and facilitating publications anchored by persons in the Global South. I hope we will continue to be in touch to make available as many chapters as possible, as I said, through academic platforms and individually as well. People can get in touch with me, and I'll see whether we can coordinate with the individual authors for private use, subject to whatever copyright contract that governs us is. Let me come to the end. The UNU IIGH has generously hosted this book launch. And on behalf of all the editors, I thank Dr. Revati Falke, Director, UNU IIGH, Joanna Riha, and Zaida Old, who have helped organize this. A very special thanks to Dr. Pascal Alote for making time to deliver the keynote address for this launch. She also wrote a foreword for the handbook. We are very grateful to the panelists and moderators for their excellent contributions. Last but not the least, the handbook has been authored by 120 scholars and activists, edited by a team of 12 editors, and more than 100 reviewers who gave time to give detailed and constructive comments to the authors for strengthening this handbook. This was a labor of love for everyone, and I am very, very grateful to all of them for making this handbook happen. Thank you again. Please use the handbook.
Thank you so much, Sundri, for those closing remarks. And yes, everyone, thank you for joining us. I know it's been 90 minutes, but I think it's flown by. And yeah, we're now at the end of the webinar, and please do get in touch with us or, respective authors and chapter leads to get access. Thank you.